Live from downtown Wichita, Cheryl Nutt, R.J. Dickens, James Barfield, Phil Journey, and tonight, Dr. Nabil Seyam. Now, KCTU5 presents Wichita's longest-running talk program, the River City Forum.
Good evening and welcome to the River City Forum. This is your host, Nabil Seyam. As always, we start the show by promoting the Prospector Weekly newspaper. The Prospector Weekly newspaper can be found at so many different locations throughout Central State. We have 575 different locations throughout South Central Kansas. Inside you will find hundreds of classified ads as well as the weekly newspaper columns by Ron and Cheryl Nutt and R.J. Dickens. Inside you can review the KCTU5 lineup, which you won't find anywhere else north of 47th Street. Pick up a Prospector today, because if you don't get it every week, you just don't get it. The KCTU5 lineup can also be found every Saturday in the Hayesville Times. Again, welcome to the River City Forum. Tonight is going to be, as every Thursday night, we have promised you that you're going to be watching not just a nice and good and diverse show, but we have always been sharing with you information, and we have also brought experts from different fields of occupations and expertise that can share their expertise with us, and it's beautiful, so nice. Again, from Wichita, downtown Douglas Street, we are live with you tonight, and we're going to introduce a guest that is not just unique, but he is very professional in his field. So we're going to take a commercial break. Please stay tuned. Welcome back to the River City Forum. This is your host, again, Nabil Seyam. I'm honored actually to introduce tonight a very dear friend of mine. He is Dr. Asim Farhat, and Dr. Asim Farhat is a interventional cardiologist with the Heartland Cardiology Group. Dr. Farhat is a medical director of cardiac rehab and non-invasive cardiovascular laboratory with the Wesley Medical Center. Dr. Farhat is a clinical assistant professor of medicine at the University of Kansas School of Medicine, and he has at least 15 years of expertise in the cardiac medicine.
Right. Here in Wichita.
In Wichita, Kansas. Dr. Farhat, welcome to the show.
Well, thank you very much. To be here.
I know you are busy, and that's why, in fact, my heart is beating, and I'm sure you are as well. And you are busy, and most likely you will get some paging today. So I know you're busy. It has been said to hear that the leading cause of deaths in America is actually heart failure. Mm-hmm. And the cases, according to the 2001 American Heart Association data, is about 450,000 fatalities. Again, as I said, this is a live show, and this is the beauty about this show. Feel free to answer anything, by the way. This is an open show. There's about 450,000 deaths occurred in the U.S. due to heart failure.
That's correct, Nabil. First of all, I'm honored to be on your show, and I'm glad to be here. As you know, heart disease has been for a number of years the #1 cause of death. And as time goes by, as we improve our methods in treating heart disease, mm-hmm. and as our population live longer, we will develop increased incidence of heart failure, because heart failure seems to be the end result of many heart diseases that we are able to treat very successfully mm-hmm. now, and therefore those patients are living longer to develop heart failure. Mm-hmm. So heart failure not only is the #1 cause, but mm-hmm. it's also increasing in prevalence. in frequency.
When you say heart failure, what is the terminology of heart failure means exactly? What is the heart failed, but what does it mean?
The term heart failure we use, it's really an end stage result of enlargement of the heart and weakening of the heart muscle. So the pump becomes unable to pump the blood to the body, and the blood will back up into the lungs and cause trouble breathing.
So does that mean less blood flowing into the body or the heart itself?
Less blood flowing into the body and more blood going backwards towards the lungs and interfering with the breathing.
What about oxygen itself?
That's basically what it is. It's oxygen carrying capacity of the blood will be diminished because of the heart becoming more enlarged, and because of the heart becoming weaker and unable to pump enough blood to the body.
Now, the second leading cause of death in the U.S., according to the 2001 American Heart Association data, is sudden cardiac death, and it's about 300,000 cases of those a year. That's even pretty high.
That's correct. You know, the heart failure patients, the way they die, either from the heart becoming weaker and weaker, and they die slowly in that way, and about half of those patients die that way. On the other hand, about a half of heart failure patients die suddenly, and sudden death is the death that occurs unexpectedly, and half or 2/3 of those patients have heart failure as well, and the other third to a half usually have heart attacks.
So sudden cardiac, exactly. It's caused. I know it's hard problem, but it was caused because of other reasons.
Yes, sudden cardiac death usually occurs because of a rhythm problem. So the heart all of a sudden develops an electrical imbalance that creates sudden rhythm problems. So the arrhythmia will be. The arrhythmia will be an electrical imbalance within the heart that creates the heart to become all of a sudden incompetent and unable to the body, and the person will die suddenly.
What about the relationship between sudden cardiac death and the blockage itself?
About half of those patients who have a sudden cardiac death usually have a heart attack resulting from a blockage. But the other half may not have blockages. There are many of them actually have heart failure, and some have some other diseases that are less common.
Since the sudden cardiac death itself, sometimes it might be slow and sometimes it's sudden death. Why it's known as sudden death?
Well, sudden death, by definition, the way we define sudden death is when the patient dies within 1 hour of onset of symptoms.
Oh, I see.
So if somebody is doing well and all of a sudden they drop dead, or they drop dead within 1 hour of symptoms, we classify that as sudden death.
Now, medically nowadays, the death of a person doesn't mean that the heart itself is dead. They have to go by the brain as well, correct?
That's correct. I mean,
to confirm the death.
Right. I mean, when the heart stops beating, it takes a while for the brain to develop any damage. So if you can restore the heart immediately within seconds or less than 2 minutes, usually the brain would still be functioning well. On the other hand, if you delay that process, or if it's delayed because of the way it happens, that will create a permanent damage in the brain. And even if you resuscitate the heart, even if the heart comes back,